Salam sejahtera and a very good morning. A very welcome to all of you here. I'm Dr. Wong. I'm the Vice President for this 24th Medical and Health Research Week. I'll be the chair for your morning session. As you know, today will be the last day of our annual research week. What we have for you here today is the morning coffee session with our distinguished professors with the theme Strategy Towards Impactful Research. In this module, we will have three distinguished speakers, as shown in the screen. Prof. Dr. Lee Yong Ye from University Science Malaysia, who will speak on the art of winning research grant, followed by Prof. Antoniela Muta with her talk on creating sustainable research environment, and Prof. Datuk Dr. Asma Ismail, who will enlighten us on establishing and forging research network. Now, I would like to invite Prof. Dr. Tan Kyok Chin, our Deputy Dean of Research and Innovation, to introduce our first speaker for today. Prof. Tan, I pass the floor to you.
So thank you very much, Madam Chairperson, Prof. Wong. Good morning, everyone. It is a pleasure for me to introduce our first speaker of the morning coffee sessions of the Research Week 2022. Professor Lee Yong Ye will be talking on the topics on how to win a research grant. Professor Lee Yong Ye is a professor of medicine and consultant of gastroenterology, hepatology, and internal medicine at University Science Malaysia. He is a senior editor of several journals, including the journals of Royal College of Physicians of Edinburgh and the Malaysian Journal of Medical Sciences. He has published around 300 papers in high-impact journals, including gastroenterology and gut. And he also has several books, chapter, and textbook as well. He was awarded Junior Chamber International Malaysian Outstanding Young Malaysian Award in the year 2015 and Top Research Scientist of Malaysia by the Academy of Science Malaysia in 2018. He is the current president of Malaysian Society of Gastroenterology and Hepatology, past scientific chair of the Asian Pacific Digestive Week, council member of the Asia Pacific Associations of Gastroenterology, and a committee member of numerous international societies. So without further ado, the floor is yours, Prof. Lee.
A very good morning, and thank you so much for the very kind introduction as well as the kind invite from University Kebangsaan Malaysia during the Research Week 2022 in delivering this particular talk on the art of writing winning research grants. Now, there are several questions that we need to ask with regards to winning the research grant. And obviously, the first question would be what and how to get the winning research question. And secondly would be what really stop you from starting a research. And third and final question would be how should I get started? So these are the various parts of the session for today, which I will address for question 1, 2, and 3. Now, the first thing would be the first step, obviously, is to have a winning research question. But what is that question? You need to ask yourself the following. What are you really passionate about? And do you have a process of getting the question? And is my question the right one? Now let's go through 3 things in the process of having a winning question. The first would be to develop a winning passion, which I would say is an utmost important. And second would be to develop a winning process. And lastly, to reflect action and to win. Now, for many of us, or some of us have been doing research, we all know that research is a marathon, has a really long process. It may take years, cyclical because there may be years when you may be in your tip-top condition, winning several grants sometime in a row, but at other years you are just not your year. Obviously, it is a repetitive process, but most importantly, it requires a developing and a continuing the passion. And once you have that going, and the most important would really be to build up the momentum and the process. So how do we develop this so-called winning passion? Now, the most important reason would be to find an answer. When you have that really wanted to and the wish to find answers to a research question, that's when you have that development of a passion. You can find a mentor or follow inspiring researchers. This is by far one of the most common way of really developing a passion, and you will be able to find a winning mentor or really inspiring researchers that can bring you to the next level, then you are already on your very good beginning steps. The other important part of the equation is really the self-confidence. Many of us have a gross lack of confidence with regards to winning a grant. We need to clear this self-doubt, this pessimism, this negativism, and start developing a self-confidence. Now, of course, this doesn't mean that everything will be smooth sailing. We have to be able to withstand failure. We must be prepared to overcome challenges and, more importantly, develop resilience over time. Now, how do we do this? How do we overcome self-doubt? How are we able to develop resilience? Is that you may want to visualize the outcome and think about what would be the reward once you have developed the outcome. So this would be one of the way on how you are able to develop a winning passion. So momentum is really key. You just have to keep going. And this is really a process of getting the winning question. Keep getting idea, doing literature, tweaking your idea, and repeat until it is correct and right. So brainstorming research question would really involve several questions and steps. And first of all, you need to clear your mind that why are you doing this? It may depend on an assignment. You may be doing this for a PhD. You may be doing this for a master project and audit and so on. You may ask, where do you get that idea? The first thing really is to identify gaps in literatures, by attending conferences, by talking to mentors, and sometimes you will just get that aha moment during sleep or during your morning run. All of this are really ways of getting an idea, but importantly, that idea, you have to write it down and you have to really build on it, do literatures, tweak on it, and then repeat and rinse again. Now, what questions? You need to really narrow down some of the broader topic to more specific questions. And again, asking specific question requires a thorough literature review, reliable information sources from various sources, obviously. It could be literature, it could be mentors, conferences, and so on. So how to know which is the right question? Again, repeating the cycles, and you may want to have some form of a checklist to know whether is this the right question. But as you go along, you will know that this is the right question for your research. And this is how you use that particular question for your grant. Always reflect on the question. Is it researchable, specific enough? Is it doable? Is it novel? Does it have an impact? And how do we act on it? You might want to write and edit many times. We may want to do pilot or preliminary studies or experiments. You can educate yourself by searching the database, referencing library, critical appraisal, and to learn how your emotions, controlling them, your stress. We mustn't get too greedy, too lazy to start anything, or too restless, unable to sleep, or doing everything at the last minute, or having to rush a proposal. It will not be a winning research proposal if you need to rush it at the very last minute. So the next question really is, ask yourself, what are the excuses that have stopped you from starting? Is it too difficult to start? Is it because of time factor? Is it that you are overwhelmed by clinical practice, or you have just given it up even without even starting? Now, when is it too difficult to start? Is it that you don't know how to start, or do you just stop at introduction, or too short a period to submit? This could be some of the reason why you feel it's too difficult to start. Very often, many of us would have what we call as the writer's block. We just keep staring at the blank page, and we have problem and struggles to find any words to start. Now, there are several reasons for having writer's block. One would be we always want to follow the rules of writing. We want to have the perfect grammar from the very beginning. We want to start with the introduction first. And all of these are rules that really stop you from writing. You may have that emotion, the anger, asking yourself, why do I need to do this? So again, emotion or psychological factor is a very important reason for really stopping you from starting. The kind of anxiety or feeling that you are just not good enough, or, again, self-doubt. And sometimes you are comparing with others. And this is also one of the important reasons that you keep feeling you are just not good enough, and you just don't know how to start. Now, if you really feel that you have a block that cannot be changed for now, it's always good to consider taking a break. Just distract yourself with doing things you like, and then just come back with a fresh eye. Also, we need to have that free feeling. Just write as you feel free. Do not restrict yourself to rules. Do not think that you need to have the perfect grammar from the start. Do not restrict yourself by having to start with the introduction paragraph first. Always try to write the most simple one first, the one that you are really comfortable with. Also, create a deadline. In fact, time pressure always provide you with some form of a focus. It can also force you to avoid bad decisions. Make the process a bit more visual. I like to have post-it notes, colorful post-it notes that will allow me to have my idea on them and work on it. I love to draw diagram, flow charts, summarize my data first on tables before even writing out the results. Again, do not think of language or rules of writing for now. Also know yourself. Are you the person who like to write in the morning, who like to think and get the best idea in the morning? Or are you very much of a night person? So you need to know yourself. And like for me, I am a morning person. I write the best around 4 to 6 a.m. And I've been doing this for a number of years until probably quite recently. You need to know what really distract you. Once you have started writing, try to avoid any thoughts that may have been a distraction. It could be food, it could be family issues or problem, it could be because you have difficulty in sleeping, stress over work. You may be also have your phone in front of you, your WhatsApp messages. All of these are distraction, and it's best to know that if they distract you, these are the ones that should be avoided when you are writing. Now, there is what we term as the Pomodoro technique. This is a simple technique where you can decide, first of all, what to write, and then you set a timer of writing for approximately 25 minutes, and you don't stop writing until the time is up. And after that, you can take a break and repeat the steps 3 times. This is a very effective technique. Again, it will help you from getting distracted, and you also have a time pressure, and you would know that the time limit itself is not restricted to a long period, not like 1 hour and so on and so forth. So, but very important is that you need to find the right time, sit down, get out from any distraction, and just focus on the Pomodoro technique. Now, very often is that most novice writer will start with introductory paragraph first, or even background, but then couldn't go on after that. In fact, I would suggest to write your grant, the method first, and there's several reasons. One is that you are already an expert or very familiar with the methods, and it's more consistent, a bit robotic, and needs less creativity, unlike results or even introduction, where you do need to put some thoughts into it before you can write. And of course, you can easily refer your method to any existing literatures. You can refer to your colleagues who have been helping you with the methods. Do provide visuals. I mean, any people or reader of your grant would find it really useful to have a flowchart in front of them or diagram to help them give a bigger picture of your grant. Too short a period to submit, and this is again a very common question or common scenario where the announcement of the grant only come out a month before, and that's always a time when we are rushing the proposal. But this is not possible. A good quality proposal may need several months to produce. I have a FRGS grant project where I have started the proposal discussion and revision and come back again with more discussion and revision again. It all took me and my peer student more than a year before we got what we thought is the right proposal, the winning proposal. And we got the FRGS grant, by the way. Furthermore, you need to find collaborators, you need to refine the proposals, you need to collect patent info, drop budget and quotation. All of this actually creates stress. And if you were to rush them up, that is a reason why you just give up or produce a mediocre proposal. So what should you do? Yes, meaning start early, have a proposal ready months before you need to submit. A most common problem that most people will give as an excuse is no time. First, you may say there's no suitable time, or you have poor time management, or did not really stick to the routine. I'm sure you have heard this very often. I was so busy this week, I just didn't have time. I will do it next week. There's always a next week. I'll get cracking this weekend, but it never materialized because there's always this Netflix or any other movies waiting for you. So there will be always be excuses. There's really no perfect time to write. Poor time management and neither have a routine nor sticking it to the routine. It's very important to develop a writing behavior, a writing routine that if you don't write, you feel really weird. And that's a time when you feel that you are really have the writing bug. So when it comes to no suitable time, try to make it as a habit, as I mentioned. And this can be done by, having to choose a time in a day when you have no distraction and just repeat it every day. Have a plan or outline of what you want to write, choose a deadline, and set up your own personal writing space. This should be a fairly quiet room where you are not disturbed when you need to write. Well, there should be adequate coffee and water nearby, adequate lighting, and invest in a good chair, just like you are investing in a good car for long travel. A good chair is really vital. So do not check any emails or phone messages during this time. Well, I do sometimes would play some really light music, and motivational quotes may also work for some. So do not make excuses not to write. I just like, for example, I just want to finish my final Netflix episodes. I have to travel for a meeting. I have many unfinished teaching assignments. These are excuses. So very often is that, university do allow academic time, use that, or some may take writing holidays rather than, traveling to Europe and so on. You may want to take, a few days off just on your own and use it for writing. Or you can even plan really a weekend for your writing. Establish a writing schedule. Spend an hour each day from 5 to 6 a.m. and that would be me. And I would just use the Pomodoro technique, set a word count, and then repeat it every day without fail. So do not try to break the routine unless there is an emergency. And if you do it correctly, you do it well, do reward yourself sometimes. Another common excuse or reason would be you are just overwhelmed by your work, by your clinical practice. So we sometimes need to know what is the correct priority in the right setting. Know why you are writing a grant, and I think one of the way is that you should integrate research into your practice. So the common excuse would be I'm always busy with my clinical work. I'm just too tired by the end of the day. My clinics are just never ending. We never think that research is as important as a clinical practice. And there's also a reason why that you don't want to do research. You always just think that seeing patient will be my most important task. And we don't know why we want to write a grant. There's a gross level motivation to do it. We did not integrate what we do in research into clinical practice. In fact, if you were to integrate what you do, it will help your patients. For example, one of my interests would be on the use of intermittent fastings in disease activity of fatty liver. So, in fact, we have published this paper at how effective the intermittent fasting is in some patients with fatty liver, and I would integrate that part of my research into practice. And it did actually turn out well. I mean, some patients really do well with, the introduction of a technique that we actually publish. So start changing your mindset. We need to think that research is as a priority as a clinical practice. Also set your priority in terms of time management. It could be 40% of your clinical work, 40% of research and writing. So start getting motivated, find a reason to do research, know your objective for writing a grant, and stick to your goals until the time. It is already a long journey. And lastly, mix research with practice. So what are the gaps in your practice? What can I do to improve my practice? And how do I integrate my research findings into my clinical practice? So these are the 3M: mindset, motivated, and mix. So hopefully you can take these 3M back into your practice. Okay, now, so how should I get started? You need to know what are the sections you need to write for a winning research grant, and this will include research background, objective, methodology, flowchart and milestone of research activities, the expected result or benefit, and lastly, budget. Let's talk about the research background, and this typically consists of problem statement, research questions, and literature reviews. So overall, the research background is probably the most important, of course, other than executive summary and title. And the problem statement itself describes really the gaps. And this is really the section that provides the reason why we need to do the research, and also form the basis for the next session, i.e. the research questions. Now, your previous work, what you have done, your own publications, and maybe some pilot experiment that you have done, or other preliminary results can be included in these sections. And we must not mistaken problem statement with literature review. This is really two different things. And provide a conceptual framework. This really will help again the visual for the reviewers to get the bigger picture of the underlying concept for the research. So what are the questions that will allow us to address the gaps of problem statement would be part under this particular section. And this must be specific. It should include certain risk factors and outcomes, a mechanistic component, especially for the FRGS grant, which is fundamental, probably 2 to 3 mechanisms, and ideally should be linked with each other. The literature review itself is purely providing the data, including epidemiology and impact or crisis of the studied problem. So basically, literature review provide the data, provide the pain of the reasons for the background of this current problem that you have. So you describe the factors. It could be both established or recently established, or even not established, but may have the potentials. Now, it's very important that when we review literatures, it should be the most recent ones, meaning the past 5 years. But if you need to include all literature, then this must be a really pivotal or even landmark papers. Also use this section to explain the basis for the old and the new methodology that you are using in subsequent sections. For objective, it can be general or specific, and general objective should contain all elements, including the question, the methods to solve, and expected outcomes. May have 3 to 4 specific objectives, although it could be more. But then it could, for a research grant, it's just need to be very specific objective that you need to solve the problem. It must be linked with each other. And when you are drafting a specific objective, also consider what could be the statistic that you are going to use to address the objective itself. So let's come to methodology, which include design and study population, research tools, and statistical analysis. Now, the study design, the population, sample size, inclusion-exclusion criteria, the research tools, and statistical analysis are the common components in any methodology section. Now, a good knowledge of study design is very important, and it may differ for a different objective that you have. It could be observational, which may include design including cross-sectional, case control, and a cohort. Now, study design often determines the variables that you have. For example, whether categorical compared to numerical, and also the statistic that you are using. The sample size can be derived either by using some of these established calculators, including the PS software, SPSS, and so on. And very often it need to depend on the study design, and it also depends on the specific objective. So the inclusion and exclusion criteria must be provided in detail, and they are not they should not overlap, and they should be mutually exclusive. With regards to research tools, you have to describe each of them separately and must be explained in detail so a layman can understand. We must not assume that the reviewer of the grant is an expert of your research, and therefore you need to write in such a way that the reviewer will understand and know what you are doing. Again, use visual to describe method, for example, diagram, charts, and so on. As for statistical analysis, you need to mention what are the software used, mention the company and the city of the software. You need to include what are the descriptive data, which can be either categorical or numerical, whether they are normally distributed or skewed, what could be the association test that you are using at univariable level or multivariable level, what would be the significant level. Typically, this is a p-value, or it could be the 95% confidence interval. Now, typically for most of experimental or fundamental studies, they do not usually need to use complex statistics, unlike any of those interventional research. So what are the expected results or benefits? This is something what we term as impact or deliverables as outcome from your research. It could be in the form of novel theories or new findings, new knowledge, or what could be the impact on the quintuple helix and other output, including publication, talents, and also patents. Now, this novel finding is really what we need to demonstrate or to confirm the fundamental basis of our studies. Now, novelty can be from either methods or from research or mechanism. Now, a breakthrough research usually requires questions to identify the gaps. We commonly know all these so-called the W question, the who, the what, the where, the when, the why, and also the how. Very often is you might need to think them outside of the box, consider transdisciplinary, mathematics, engineering, and so on. Like for myself, I have a postdoctoral fellow who is an engineer, and we keep talking about some of the potential medical innovation that will solve some real sense clinical problems. And we are learning from each other in that sense, because the kind of language that we speak may be different, but at some point it will overlap. And of course, really transdisciplinary research can be more exciting because we are at least learning something that is out of our own field, and we are more excited about it. Of course, we need to consider findings on novel theories from literature reviews, conferences, discussion with collaborators, and so on. Now, the quintuple helix, this is obviously something to a concept, an innovation model or framework with the aim to tackle the challenges from the aspect of the society, academia, the government, the industry, as well as the environment. Now, we need to understand what are some of the global views, including the United Nations Sustainable Developmental Goals, and what are some of the national policy that will fit into the quintuple helix, including the 10-10 SDIE, which I'm sure Prof. Asma will be talking passionately about this, and more recently, of course, the Shared Prosperity Vision 2030. So really the keywords are sustainable, innovation, community, the knowledge economy, and synergy, where it is about the private and the public partnerships. Also explain very specifically the potential application of your research findings. So this will confirm that your research is potentially really translatable from the bench to practice. And this should be something that also be considered for future grants. Now, in terms of output, and this can be in the form of publication, and we need to ensure that it must be delivered, but we should not overpromise. Therefore, always make sure that you give that appropriate target of publication. Likewise, we should aim for a talent output, either a PhD or a master students. Now, intellectual property may include patent, copyright, and so on. Certain grant may be compulsory, but it could be just a bonus output, which give you extra marks for other grants. So as a conclusion, winning research grant really come from winning question. This would include the act of passion, the process, and to reflect, act, and to win. So the common excuses include too difficult to start, no time, being overwhelmed by work or personal issues, and difficulty in getting grant. So think about whether any of those excuses are really stopping you. The proposal should consist of sections, each provide comprehensive and specific or focused details. With that, I thank you very much.
Thank you, Prof. Lee, for this such an interesting thoughts on how to write a winning research grant. Very practical and very mind-blowing in terms of how you come into this stage as a clinicians, which is tough. I believe we are trained to develop our clinical skill. We are not like scientists who are trained as second nature to write research grants and writing proposal and writing manuscript and publications. So I noticed you put there 3M, changing mindset, motivated, and mix. That is the way that to change the clinicians into research.
Yeah, thank you, Prof. Tan.
Very nice indeed, Prof. Lee. So, but if, before I open the questions to the floor, maybe I can ask a few questions first. The first one is practical wise, how do you can change the mindset of the clinicians? How do you practically change them? Because I know they should change, but it's actually quite difficult in that sense.
Yes, I think this is probably the most important question. A lot of time is that we never think about how we can integrate the research into practice. And what I mean by that is that, for example, when we are seeing a patient, we didn't think about that, or what other data that we may be able to collect. For example, we know that to determine the success of a treatment, we might want to determine the quality of life. But because we didn't actually develop a process or a way of collecting those data and use that data to demonstrate the effectiveness of or the impact of your clinical practice. And therefore, we don't really change that kind of a mindset. So it takes a bit of a time. How do we want to integrate that research into practice? Because there's a lot of reason why we can't do that, right? The system is not there to help you, or the limited time that you have, the number of patients that you are seeing in the morning, you just want to finish up the work. There's always these challenges that prevent it from integrating your research into your clinical practice. But if we are able to slowly, I think we cannot change the system, definitely. It's very difficult. But then again, as long as you have a process, you develop a game plan, a strategy, that will eventually work out. Like for myself, I do have a team of people, fellows, and so on, if we can work together, that would be really useful. If you're on your own, it's actually very difficult. But if you have a team of people working together, having the same passion, wanted to do good, that itself is really a plus point for you to change that mindset.
Thank you, Prof. I totally agree with you about the team that should develop. I have the benefit of having a team when I was a junior specialist at that time, and that really helps me a lot. So I can reflect back what you are saying at this point. Still remember the last time I met you on the webinar, and the thing that I cannot forget is you always say turning crisis into opportunity.
Yes,
which I
exactly.
remember until now. The other things that you brought up, withstand failure, I think that is something all scientists and clinicians should have a characteristic of withstanding failure. So I have multiple failure in grant applications, and I think that is very demotivating, and we need to overcome these particular things that, as you mentioned just now. Just want to say that if you have any questions from the audience and participants, please welcome also to put in the chat. I saw a few already. I'll be reading on to the questions to properly in a while. Okay, I think not to put too many questions from me. Let's have a look at the questions. Okay, these questions is from Prof. Wan. Hi, Prof. How to avoid procrastinations in writing? We, as a clinician scientist, wear many hats. How to avoid burnout that will affect our research activity, in example, writing high quality grants?
Yeah, I think the procrastination is really a difficult barrier to overcome initially. So that's the reason why we need to develop routine or a habit. So once you develop a habit or daily routine that you need to keep doing, then that will be the best method to overcome this procrastination in starting and so on. Again, it takes some sacrifices in the beginning because it's very painful to change into a habit. So that's the reason why not many people can do it. For example, start waking up 4 a.m. in the morning. Start writing during that period of time. From the very beginning, when you first started doing it, is extremely painful. Keep on turning your alarm clock every day at 4 a.m. And then it's very painful to wake up at that point of time when your mind is still foggy and you need to start writing. But as you keep doing it over the few weeks, as you become routine, that everything will fit in very well, because I think our body is very good in that sense. It can adapt to it very quickly into a habit. Just the way how our brain works. Now, of course, the other important question is that you asked here is about how to avoid burnout. In fact, I think this is a very important, a very critical issue. If you're interested, I do have a paper which I published in the Journal of Royal College of Physicians of Edinburgh on burnout. It was published quite a number of years ago. I did publish a method. I call it the traffic light, where first of all, the red color means that you need to first of all stop and think about why are you having a burnout. You need to identify the reason of your burnout. Is it administrative? Is it because of the system? Is it because of your family issues? Is there personal issues, your emotion, psychology? So first of all, stop and think, what are the reasons? And then try to, the yellow part basically is, really sit down and think how to, or plan out what are your, what should you do in order to, at least decrease that kind of burnout. Should I take time off? Should I start dedicating my work? Very often is, we always feel we are the most important person in the world, and people cannot survive without me. I have to take care of or micromanage everything from anything. So that is a kind of, we need to start thinking that mindset, and we need to know how to delegate certain tasks, set your priority. And then after that, the green is obviously to reinforce, and again to readjust all this plan on how do you avoid a burnout. Now, if you're really interested, you can just search on the article that I wrote, and that will provide you some clues or some method on avoiding burnouts.
Thank you. Another question is how do we remotivate ourselves if our grants keep getting rejected?
Yeah, it's very frustrating, very demotivating, as exactly like what Prof. Tai you have mentioned. I think it happened to all of us in my early career. Yeah, multiple times when I just couldn't get the FRGS grant. The thing is, sometimes you need to learn to let go, right? You have tried 3 times, for example, and you still couldn't get it. Then it means that I need to let go and start thinking on the next project. We cannot keep hanging into the project and you think that I must push it through. It sometimes it never happened that way. It could be because at that point of time, the reviewers or the priority of the grant committee is very different. It's not their main theme that they wanted. Therefore, we have to be adaptable. We need to learn how to let go and start thinking of next project and next project. So we cannot just keep thinking on the same idea all the time. We must have a number of ideas that is going to work, and start building up that idea into a more solid research question. So the most important is really we need to have a solid research question that will able to deliver impact and work on that. So always have a number of ideas and not just keep on harping on the same one.
Thank you. Perhaps I got one more questions. What is the USM strategy in getting all the lecturers to write research grants and apply?
Yeah, in fact, I think recently our I think VC and our top management has released some data showing the recent FRGS, for example, we've been getting more success. I suppose I think there's several reasons for it. One is that the administrator is giving more support rather than it's not about pushing. It's not about demanding the lecturer to say if you don't do this you will perish, but rather is to have a common goal together, that if you secure the grant, then it also means that it is helping yourself, not just the university. And the UC itself also need to provide a lot of support in that sense. They will, for example, finding a expert who are able to provide mentoring or providing advice. Also doing a lot of workshops, helping out the young researchers, giving the young researcher opportunity to rise. And of course, also that the individual researcher themselves, I mean, again, changing their mindset. So by hearing from more established researchers, we do have quite a number of previous researchers who are really good in writing and getting grants. Hearing from them, their experience, it really helped to build confidence. It really helped to know that this someone who are there, ready to give you advice and help you in sense. You have to move the lecturer along or in alignment with the institution, rather than really forcing that so-called publish or perish mentality.
Okay, thank you very much for your insight on those things. I think we are passing our allocated time already. Once again, I want to thank you so much, Prof. Lee, for the excellent talk, and thank you for your time in sharing the moment with us. Thank you being with us today.
Thank you so much. Always good to see you again.
So I pass the sessions back to our Madam Chairperson, Prof. Wong. Thank you.
Thank you, Prof. Tan, and thank you, Prof. Lee and Dr. for a very interactive session. I believe that all of us here have got some ideas and some tips on how to write a research grant. Welcome back, everyone. The second part of our session. Now I would like to introduce our second speaker for today, Prof. Dr. Antonella Mota. Prof. Dr. Antonella Mota is a full professor in the Department of Industrial Engineering, the chair for the Bioresearch Center and Biomedical Technologies in University of Trento, Italy. He's also the visiting professor of our university, UKM, Associate Director of Bioactive Resource for Innovative Clinical Application Research in Bangkok University, Thailand, and a member of the European Institute of Excellence in Tissue Engineering and Regenerative Medicine. Prof. Antonella has supervised to about 25 bachelor students, 15 master students, and 45 PhD international students. Her research topic of interest include biopolymer-based scaffold design for regenerative medicine application, selection of new organism source isolation process, instructive scaffold design and characterization, implantable device and matrices for tissue engineering application, in particular a 27 years experience on silk-based matrices for application in tissue engineering, such as bone, cartilage, and brain. Professor Antonella is also the editor-in-chief of the Journal of Biomaterial Science Polymer Edition, co-editor of a book on tissue engineering, scientific editorial board members in many international journals. She has published in more than 180 papers in various international journals and 14 book chapters. She was frequently being invited to speak in several international and national conferences. Without further ado, I would like to invite Prof. Dr. Antonella to deliver her talk on creating a sustainable research environment. Dr. Antonella.
Good morning. Let me first of all thanks to the organizing committee to invite me to give a talk at that conference at the Research Week, and they're giving me the possibility to share with you our approach to medicine with the concept of sustainability and circular economy. Let me start with the opinion of European community that is strongly supporting strategies able to follow the sustainability, green chemistry, and low environmental impact. This is not a very new concept, but what is relatively new is the application of this concept to the medicine. Medicine, where the idea is to combine material performances, human health and sustainability, and the core, the central part of the story are the use of natural materials, as I will show you during my talk. To reach this goal, the idea is to use materials derived from biological sources, from waste, industrial and food waste as well, and of course to follow biomimetic strategy in order to be more efficient in the application of this concept. This is the scheme of the production of new materials and devices for medicine, and what we are trying to combine is the quality control to have a faster application into the market, to the clinics, with sustainability, that is a concept just introduced in the previous slide. So the story starts from the selection of materials, raw materials. In our case, the idea is to use mainly biopolymers that should be engineered in order to have precision biopolymers able to be used in a different application, in particular considering the precision medicine, the personalized medicine. Then we have to move to the manufacturing and finally to the biological evaluation. What should be taken into consideration step by step? For example, in the use of polymers, if sustainability is our approach, we are considering first of all the use or the reuse as well. Is better to define reuse, industrial waste, food and, for example, textile industry. I will show you in a few slides, to design reproducible protocols that can allow us to save materials, time, and cost, and to design manufacturing method. Try, for example, to reduce the temperature needed, the time of production, and of course, as a consequence, the cost. Finally, there are two more concepts that we use in the biopolymer selection and manufacturing as well, is the selection of reactants, consider the impact on the environment, and eventually if these specific reactants should be used for the efficiency of the protocol, we should design other method to reuse and to recollect in order to avoid the impact, the negative impact on the environment. And finally, these are two concepts that Mother Nature knows very well, the recycle and the reuse. Manufacturing are used to produce then several types of medical devices, from implantable permanent devices to tissue engineering, artificial matrices, as well as the in vitro model for screening, personalized medicine, and testing. This construct then should be evaluated. This is another point we have to take into consideration. We have maybe to redesign, to reevaluate our protocols, consider that the starting material is a nature-derived polymers, so we have to design preclinical evaluation, and thanks to collaboration, external collaboration, to have a multidisciplinary team in collaboration with biomed companies in order to obtain, to try to move to the market sustainable products in medicine. So all of this is designed in order to reduce the time of production, reduce the cost, of course increasing the safety and the precision of our devices as well as the specificity. What about the biomaterials? Of course, this is a general scheme that I use in my talks to demonstrate what should be done with the starting polymer. At the beginning, we have to select specific biopolymers as a chemical backbone, but these polymers should be designed to have precision biomaterials in order to design a platform that can be applied to several applications, but by starting from a small number of backbones and polymers starting polymers that can be improved through functionalization in order to provide to the cells the suitable environment to promote tissue regeneration, for example. And then this depends on the final goal, if you want to have matrices that should be populated then by cells, or if cells should be entrapped during the processing. We can play with the cross-linking degree, we can play with the cross-linking molecules. We have the opportunity to use enzymes as cross-linkers. In this way, degradation of the material will be driven and controlled by cellular activities. That's the reason why natural-derived polymers, once again, are very, very promising. We have a number of fabrication methods designed for these specific polymers. We can blend them with other natural-derived or with the synthetic polymer when, for example, specific peculiar mechanical properties are required. We can play with the cross-linking. We can functionalize them in order to put into the structure the perfect language to instruct cells to promote what is needed for the therapeutic purposes. And of course, we can have also the possibility to include the releasing system. Just to give a brief idea what means reuse and the use of waste, for in this case from food, consider the crab that is used for human as a human food, but after that after the use as a food we have a lot of waste. The waste are the carapax. Carapax is a chitin. Chitin is a very interesting polysaccharide that can be used as it is or can be deacetylated in order to obtain a chitosan. With the chitosan we can obtain several medical devices. For example, we can use outside of the biomedical field the chitosan as a filters. For example, was proposed as a system for seawater purification, or can be used as addictive in the human nutrition, but it was seen to be able to treat, to have some positive impact in specific renal pathologies. Finally, we can have the use of the reuse of this polysaccharide in the textile industry. Some fibers can be obtained, and some textile with specific properties like anti-static or anti-acarose, just an example. But of course, what we are interested more is the reuse of this food waste in medicine, and several matrices are obtained. There are protocols to obtain a thermoresponsive hydrogel and so on. And also in this case is a polysaccharide. The polysaccharide is the several functional group that can be used to functionalize the polymer in order to have a precision material at the end of the story. Of course, we don't have just crabs. We have a number of sources, each one producing a specific chemistry. We have a protein like a collagen and silk. We have a polysaccharide, but we have also the muscle shell, for example, that can be used as starting material to obtain bioceramics. These polymers are obtained and the specific processing methods are designed in order to produce several strategies from cell entrapment to solid porous material, and several applications can be considered and approached. During my talk, I will focus my attention on silk polymers, but also in bioceramics. So we have several silk producers. Of course, we don't have just the Bombyx mori, we have the wild silk, but we have other insects like bees that produce short silk fibers that they use in combination with the wax to produce a honeycomb, to have a better mechanical properties, and then we have a well-known arthropods, but also mollusca produces silk. These filaments that are named byssus are made by the combination of silk and collagen together. But this mollusca can provide the shell and other food waste, of course, that can be used to produce a bioceramic. I will show you in the next slide what can be done and the value in the medicine. So what should be done when we want to start from food waste? Of course, not just mollusk shells, but also eggshell, cuttlefish bone, just example. These are material we are considering nowadays. And with the help of Professor Vincenzo Sglavo in our department, a specific processing method, flash sintering and cold sintering, were designed in order to produce bioceramics, reducing the temperature needed. Usually to obtain ceramics, sintering is done at the degrees 700, 800 degrees, even higher temperature. But of course, we want to be more sustainable, reducing the energy involved. So new systems are designed trying to reduce as much as possible the temperature needed. Nowadays, we are almost close to room temperature. And this is quite important for a couple of reasons. Not just because the energy involved is lower with saver energy, so more sustainability, but also because in the muscle cells, for example, shells, there is not just inorganic phase, there is also organic phase that is very important for the biocompatibility. And if the process reduces the temperature, even the organic part can be saved, so improving the bioactivity of the final material. After the sintering, a powder is obtained, and this powder can be printed to obtain a scaffold for bone regeneration mainly, and thanks to the printability, several architecture can be obtained even with some gradient to approach applications such as, for example, the osteochondral defect. This is was done according to the Green Chemistry Pocket Guide that you can find in internet. There are 12 indications to be green. These are named the principle of green chemistry. So in this case, we can approach the number one, preventing waste. We can reuse. Less hazardous synthesis because we just use a low temperature to transform this organic bioceramic into the ceramic that can be also manufactured. Design for energy efficiency, reducing the temperature and the time of the properties, and reduce the derivatives because the process is quite clean. Just an idea on how we can apply this concept to the lab work, to the medicine. What is interesting, of course, is also the bioactivity, as I mentioned before. So first of all, the processability, design the process, reduce the energy involved, and reactant that can have a negative impact on the environment, but then we have to assess the bioactivity. So we produce some scaffold with the bioprinting by using bioceramics obtained from 3 different sources and compare with the commercial hydroxyapatite. As you can see in this case, this specific case, the bioceramics was combined with a synthetic polymer, polycaprolactone, and of course compared with the pure polycaprolactone. As you can see also in this time, the possibility to use the printer, so we can bioprint 3-dimensional structure, and then we culture cells. These were osteoblast cell line, cultured up 7 days. As you can see by looking the green in the picture, you can see the difference between the pure synthetic polymer and the synthetic polymer in combination with the bioceramic. We did something like this by comparing with the commercial hydroxyapatite, and the results were very similar. The use of bioceramic is much more bioactive for bone cells because the presence of microelements that nature combine in the shell of the muscles that are very beneficial for the metabolism of the bone cells. Moving then to silk-based devices, what can be done to be more sustainable? So first of all, I would like to show you how is used. A number of applications are already considered nowadays. Several kind of structure obtained and several protocols were designed. And silk is not just a research level. We are doing more at this level, but we have already into the market a product silk-based, as you can see in this list, that are FDA approved and used for several applications from tissue support to meniscus, anterior cruciate ligament regeneration. But what can be done to introduce sustainability in the use of silk in medicine? We have to go back to the multi-step process of the silk, and of course the silk is produced by the silkworm. This is the producer use mainly for silk in medicine. After that, the cocoon are collected, and the cocoon should be purified with a mechanism named the gummy that is used to remove the superficial water-soluble protein named sericin, and then this fibrin fiber should be used to fabricate by following, for example, the step of dissolution and then manufacturing final the storage of the protein-based device. What can be done to be sustainable? We should go step by step, considering the silkworm breeding, considering and controlling the environment of breeding from humidity, temperature, and the food we have to go to provide to this insect, controlling the life of the silk. We can control the quality of the silk. Then we should move to the gummy, for example. The silk fibers, we can use several protocols, but we have to take care about the chemical use, trying to define the minimum concentration to have the maximum impact, positive impact. We have to redesign protocols to reduce temperature, the time of treatment, and the volume of water used in order to be more to have a better economy into this step of the silk processing. Moving on, the device fabrication. These are the same concept as explained before. Also in this case, we have to reduce the negative impact on the environment, reducing time and hazardous reactants. Finally, the storage that should be possibly at room temperature, avoiding the use of -20 or -80 that can require a very high energy consuming. These concepts are recapitulated in a project that just started 1 year ago. This is funded by European community named Shaping Innovative Products for Sustainable Tissue and Engineering Strategies. It is our pleasure to have in the team Professor Fauzi Busra, that is taking care the production of matrices for skin regeneration, starting from collagen, mainly collagen. Let's go a little bit more in detail into the protocols. For example, what can be done in collaboration with textile industry. You can see the multi-step recap into the slide. But what is the message of this slide is that each step can produce silk fibrous waste. It is a waste that can be short fibers, can be sericin into the gummy bath, can be obtained during the spinning, during the textile production, and considering 100% of the material at the beginning, what we can obtain is almost about 40% of the starting weight. This means that we have a 60% of waste that can be used, reused, and applied to different fields, from cosmetic, already done, to medicine. For example, sericin can be used as anti-cancer in specific application. What about the principle of green chemistry use? Of course, preventing waste, reducing the hazardous synthesis methods, design with the chemical that doesn't have a negative impact, design energy efficiency, for example, reducing time and temperature of the gummy, and reducing the derivatives, because derivatives are reused, recollected, reused for different applications. What about the use of protein from waste? That is a very nice example. This is a piece of work we did with a university in Colombia. that we try to recollect the sericin, the water-soluble protein that is coating the fibers into the cocoon, by using defective cocoon or normal cocoon or waste from the short fibers. That's to show you what it means. We have several opportunities. This is good, but this means that we should be very careful in the quality control, because we have a different waste of sericin, but depending on the waste source, we can obtain different chemistry. Just looking in some amino acid, as you can see, for example, in terms of alanine, we have different content moving from the Bombyx mori cocoon sericin isolated with the standard protocols, and compared with the defective cocoon, you can see is more than double the presence. If the chemistry change, means that the property will change, and we have different bioactivity. Is a more opportunity, but means a quality control. And different chemistry means a different ability to assume a different conformation. For example, this is related to the fibrin isolated from different sericin, isolated from different sources again, and because a different chemistry. If you look just at this histogram and consider, for example, the alpha helix conformation, depending on the source, the sericin can assume different crystalline degree, but also different conformation, increasing alpha helix or increasing random coil. And this means changing the hydrophobicity, hydrophilicity, but also the functionality and the impact on the cellular behavior. Moving then to the processing method, we are optimizing our method, again considering the possibility to reduce the time, the temperature, and the cost. This is just an example. This sintering of a solid fibrin designed by Professor Maniglio and Dr. Bucciarelli. They try to start from freeze-dry fibrin isolated from waste, freeze-dried, and the powder is treated in compression in presence of water with a very, very mild temperature, very close to the room temperature. And with this system, solid material are obtained that can be cut by laser, obtaining different shape. Of course, these are not needed for medicine, but just to show the tunability and the possibility to change the shape and to adapt the shape depending on the application. Even in this case, the biological activity was assessed and the cells were seeded. These were human mesenchymal stem cell. As you can see, in 10 days, the structure obtained by laser, by sintering and laser cut were completely populated by cells. You can see here they are differentiated in bone cells. Of course, sorry, in here you cannot see the differentiation, but just by shape. And then we did some gene expression to evaluate the ability of these cells to become bone cells and start to produce bone. Another concept is applied when the scaffold should be also functionalized with some drug release system. What is the concept of sustainability? To be very efficient, reducing the amount of the reactant used. What we have to do to reduce the drug? We have to load the scaffold. First of all, we have to identify the pathway we would like to activate to be very specific. This is a nice example, piece of work done in collaboration with the Orthopedic Institute Rizzoli in Bologna and the Emory School in Atlanta, US. And the idea was to improve the ability of the bone to regenerate even in osteoporotic patient. And as a mechanism was identify the mechanism used by bone cells to produce endogenous sulfur that is needed for bone synthesis. In particular, the pathway based on the beta-catenin. These people, the group of Rizzoli Institute, Dr. Grassi, identified this sulfur donor, GYY, and at the beginning this was used at systemic level, injecting into the osteoporotic animal, having beneficial effect, but with the need of daily administration of this donor. So we move to the tissue engineering. In this case, this donor was combined with a porous structure made by silk fibrin, and we load with the sulfur donor. The releasing was assessed, and the sulfur donor GYY was released completely in 12 hours. Despite this short time of releasing, we perform in vitro test by culturing mesenchymal stem cells, human mesenchymal stem cells in dynamic condition up to 3 weeks. As you can see from these images, from this scheme, the presence of the GYY was able to improve the expression of osteogenic genes for 3 weeks, not just for 12 hours, and also the production of angiogenetic factor were activated and increased by the time. So what was interesting to observe that the 12-hour releasing of the GYY, the sulfur donor, was enough to trigger this mechanism based on the beta-catenin. So in 12 hours, the system was able to be reactivated, and then the cells start to do the job without the need of the releasing of more molecules. So this is a good example how we can reduce drugs, how we can reduce the releasing time. That is very beneficial for cost and for the time, even because we don't need to maintain active the molecules for a long time. But what is needed is to precisely identify the mechanism we want to reactivate, biomimetic approach, and then to release just the time to reactivate the mechanism. And this is a kind of sustainability. So just to summarize my talk, what is needed to move sustainability in the biomedical research is to design standardized protocols to be reproducible, to save time, and the validation protocol. We have to, into these protocols, we must be sustainable, we must be environmental friendly, and to move this concept into the protocols. We have to maybe to reevaluate, to redesign also the consensus testing, and to reach harmonization between regulatory bodies in the world, so we can have just one path for everyone. This can be done thanks to the international multidisciplinarity, collaborative network, and involving young researchers and teaching them how we can do research market-oriented from the beginning, not at the end of the story. This should be allowed now us to develop a sustainable practice in tissue engineering and biomedical technology. These again are the concepts in the project I already introduced at the beginning of my talk, SHIFT. And let me at the end introduce all our partner. We have two partners in Europe, University of Trent, of course, University of Birmingham, University of Minho, the Institute of 3B's Institute, but we have 5 partners in Asia. First of all, I would like to mention TERM and the Medical School and Professor Fauzi Busra that is proposing the use of collagen for wound healing treatments, Chulalongkorn University, where the research will be based mainly on silk, and then Chonbuk University again with the collagen in South Korea, Mongolia, and they are exploring the possibility to use animal-derived proteins, animal hair like camel, horses, and cashmere for skin treatment applications. And to the other side, the 3B is working mainly with the sea marine origin materials, and University of Birmingham are involved in the translational biomedical research. With this, I would like to thank you for your kind attention. I hope that my translation is correct. And thanks again for giving me the opportunity to talk at this conference.
Thank you, Prof. Antonella, for her excellent talk. Sorry for the technical errors. But due to the time difference between Italy and Malaysia, I would like to convey sincere apology on behalf of Dr. Antonella Mota, as she is not able to join us live today. In case you have any question, feel free to email to us, the Secretariat. We would like to forward your question to Prof. Antonella. So we are actually currently slightly ahead of time. Please stay tuned with us. Coming up next, we will have another distinguished speaker, Prof. Dr. Asma Ismail, the President of Academic Science of Malaysia, who will be enlightening us on how we can establish our research network. Please come back at 11 a.m. sharp for our next talk. Thank you. Thank you for staying tuned with us. Thank you everyone for staying tuned with us. We now come to our last session for today. I would like to invite Associate Professor Dr. Wan Haslina Wan Abdul Halim, who is the president of this 24th Medical and Health Research Week, to introduce our last speaker for today. Prof. Wan, the floor is now yours.
Thank you, Professor Wong Yingping. First, I would like to welcome everybody to the session. This is the last module for the research week. And I would also like to wish a warm welcome to our speaker today, Professor Emeritus Dr. Asma Ismail. Allow me to first introduce our speaker today. Professor Emerita Dr. Asma Ismail is a woman of many firsts. Besides being the first female Vice Chancellor of University Science Islam Malaysia and University Science Malaysia, she's also the country's first female Director General of Higher Education, first female President of Academy of Sciences Malaysia, and the first female to be Chairperson of the Malaysian Quality Agency, MQA. The current position is as the Ibn Sina Chair for Medicine at the International Islamic University in Malaysia. I've had the honor of meeting Prof. Asma personally last year during one of our young academician program by UKM in Malacca. So Prof. Emerita Dr. Asma Ismail has a Bachelor of Science in Biology from the University of Nevada, Reno, USA, and the Masters in Microbiology from Indiana University, USA. And further, she has a PhD in Cellular and Molecular Biology from the University of Nevada, Reno, the same university of her bachelor degree. She also received her honorary Doctor of Science from the University of Glasgow, University of Kiel University, and also Kyoto University of Foreign Studies. She was conferred Professor Emeritus status by University Science Malaysia in December 2021 last year, and awarded Tokoh Akademik Negara, National Academic Laureate, the most highest national award to an academic in March 2022 this year. She was elected to the Academy of Science Malaysia in 2003, the Academy of Sciences for Developing World in 2010, and the Islamic World Academy of Sciences in 2016, and was elected as honorary member of the Iranian Academy of Medical Sciences in 2017. It is indeed an honor to introduce her today. Further, I just would like to add that her passion for higher education and science development ecosystem had gained international recognition as well. And she was elected as a member of several international boards, including the Board of Governors for Commonwealth of Learning, which is based in Vancouver, Canada, as well as a member of the Directing Board and Executive Committee, the Islamic Citation Center based in Shiraz, Iran, for the OIC. A member of the College of Fellows, Kiel University, UK, as also a governing advisory board member for Ritsumeikan Asia Pacific University, Japan. So we know, I think there is no better person for us to talk about our topic for today, which is establishing research network and establishing and also forging research network rather than our speaker today. Therefore, I would like to offer the floor to Prof. Asma to start her lecture.
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. And a very good morning to everyone on the virtual space. And thank you so much, Dr. Wan, for the kind introduction. Let me try to share the slides for today. And then see how we go. Boleh nampak ke? Please let me know if you can see the slide, Dr. Wan. Nampak? Okay. All right. Basically, ladies and gentlemen, first of all, thank you to UKM Medical Faculty for inviting me once again to share my thoughts on this time around establishing and forging research network. So let's see what I can do with this topic today. And what I will be covering will be the global outlook. Where is the future for Malaysia post COVID-19? I think we all need to know about that a little bit, and where are we heading for Malaysia? And where's the future of research, and why the need for collaboration and networking, and then how to do the how, because everybody can say, oh, okay, yeah, we need collaboration, we need networking, but essentially nobody actually teach us how to do the how. So that's probably what I would like to share this morning. And also first of all, also thank you, Dr. Wong, for inviting me for this topic. So let me start by saying that the world today is chaotic and is changing at an incredible speed, and is changing due to factors including digital age, the climate change, the disruptive technologies, the conflicts, and the pandemics. And the state of the world has created a disruptive change in our lives and livelihood, and now we are faced with the new normal, and it's going to be here to stay, basically. And the size and the complexity of the local and global challenges will require us to be a change maker and face change in order to stay relevant, and therefore agile response to change becomes imperative. And in today's era, we are talking about predictable unpredictability, facing many unknowns and many uncertainties in the future. And the future, I think all this while we've been talking about VUCA, but now we are no longer about VUCA. Post-COVID is now about BANI. There's another new term. I'm sure some of you may not have known about this, but because of what's happening, we are now more brittle. Still, there's ambiguity. Non-linear, that means cause and effect, as you see, is not just linear in creating the problem that we are facing. And there's going to be lots and lots and lots of data coming in from the sensors, from all the things that we are doing with IoT and whatnot. And at the end of the day, some of this data can become incomprehensible as well because of the merger between humans and machines, and the fact that we may not have the kind of data sorters and data analysts interpret some of this data that's now coming in by the millions per second. So to embrace uncertainty, our challenge is to prepare the future generation, the graduate students, and the postdocs with skills and competencies for jobs that do not exist, solving research problems not yet identified, and using technologies not yet invented. So whatever that I learned before in the US may be irrelevant now, and even whatever you're teaching your postgraduate today may be irrelevant 2 years from now. So what is important is that you adaptable and must be agile because of this rapid change that's going to happen in between, and therefore lifelong learning about new technologies, about what needs to be done, I think it's a constant thing that we all need to do, right? And lessons learned from COVID-19 boldly states that science and technology alone is not going to be enough to solve the global health problems. So the 21st century now is about the era of convergence of knowledge. So whether you like it or not, you need to work in a multidisciplinary or transdisciplinary manner in terms of the research that you're doing. And it has to be, therefore, networking now starts to come in as becoming very important. Collaboration is very important, and it's very strategic and systematic integration. Not just put people together, but the kind of solution that you're offering has now got to be in an integrated manner between science, technology, arts, and humanities, along with innovation, entrepreneurial, global mindset to meet all these challenges of the 21st century. And bottom line is that we all need to work together to provide the solutions. So notice, before we are talking about problem statement for all the postgraduates listening, or even for the young lecturers, and you are now writing for grants, before we are talking about problem statement, but now what is the solution? So basically, no longer about problem-based, but more solution-based, because tomorrow is talking about impact. And problem-based, what's the difference? Very quickly, problem-based are usually desk job. That means you do a literature review, and from the literature review, you say, okay, what's wrong with the scenario? And you offer, therefore, your solution. But this time around, when you're solution-based, not problem-based, your solution-based means to say, yes, you have to do literature review, there must be knowledge on the topic, but you need now to engage with the quadruple helix in order to actually now design what exactly is the solution that the target client would want to have. So this, therefore, whatever that you now deliver will be able now to create impact, because it is something that the target client would want to have, rather than something you want to offer. So this is therefore the era of collaboration and the era of sharing information. I mean, there's no such thing as a trump card nowadays. Now everything that you keep in your pocket can be seen by everyone already nowadays. You know, you can't keep any secret, because they can deep dive, they can hack, they can find out all sorts of information. And the more you put a lot about yourself in the Facebook, in the Twitter, in the LinkedIn and all that, what you call social media, the more the algorithm will be able to find you and actually profile you and actually personalize what you are about. So basically, all this data that you have should now be available via open access. Either your data now, if you want to have international grants, you have to show proof, especially when you want to get Horizon grant or European Union grant or even NIH grant nowadays. You have to be able to say, okay, I am sharing my data on open access, and if you can't show evidence of that, then you are not eligible to actually now apply for all these grants anymore. So bottom line, that's why Academy Science, we have MOSP, Malaysian Open Science Platform, that we place Professor Nur Saadah from UM to now be in charge of this, and MOSP is now running with the 5 research universities putting in their data, so including UKM. We have just signed to allow now all your data to now go in. So be open as much as you can and be close as much as needed. So that is the concept of fair data. So among other lessons learned from research is the sharing of information includes our research work not only needs to be published in a peer review journal, okay, but also written in simpler manner to engage the public. This is something that I think, you know, a lot of us are actually still living in the world today. But you have to know that research grants makin lama makin menipis, yeah. So it's getting smaller and smaller. And that's because tomorrow is no longer about government giving you grants, but more about the industry giving you grants, philanthropists giving you grants. And therefore, if they are now giving you money for doing this kind of research, they would want data to be shared and basically, and to be able to tell public exactly what that research is all about. Because when you start to share data, you now are publishing in metadata, no longer publishing like a Q1, Q2. I think the future of research report by Elsevier did this to basically call all the brains in the world to come together just to make sure whether Elsevier is going to survive or not. The answer is no. In the future, it's no longer about Q1, Q2, is now about metadata, the sharing of the data in the open access mode, and the future is about writing simple manner to be able to engage the public, so the public understand what exactly you are doing. So if you understand this kind of future postgraduate today, I think is very important. Especially if you are now in the RU where you are sharing the metadata on open access. So only when you start to communicate in a simple manner to engage the public, then can there be understanding to actually elicit a whole societal approach in providing and implementing the solutions that you now offer in order to be able to create impact. And this includes the translation of published works that have been done into various languages to ensure inclusivity of the knowledge that is now generated. You see, it's a whole new ball game in terms of the future of research, and therefore we can no longer work in silos, and therefore there is a need now for the integration of knowledge from the various disciplines, and this is the interplay of the sciences and the non-sciences. I'm setting the scenario for you to understand where is the future and why networking and collaboration is now very, very important. And the research that you do can no longer stop at publication. It needs to now move across the entire value chain, and it has to be creating impact. And if you want to move across the value chain, you got to work with the industry, you got to work with the government agencies, you got to work with the case, again, networking, collaboration, even just to move research now becomes important. So to create impact, there's another learning point. To create impact is no longer about ROI, return of investment, is now also about ROV, return of values. That means, you know, the kind of work that you do, don't just simply look at ROI, because there's a lot of impact that is brought by ROV, and that you can see as lesson learned from COVID, because during COVID time, nobody gave a hoot about KPI. Everybody was working together to be able to have a whole nation and whole societal approach. People, researchers around the world are sharing information even without publishing it, so that they can now have people who are working on the vaccine can now come up with a vaccine against COVID. So you see intangibles, when push comes to shove, for the human being, at the end of the day, we go back to the intangibles, the values, right? So this is some learning points that you need to see. It's no longer about numbers. Numbers suddenly don't mean anything. KPI numbers suddenly don't mean anything. So therefore, research performed today has to move from fundamental to translational research to be able to benefit the community and to benefit the industry. So in short, the knowledge creation must be for public good. So post-COVID, therefore, is working in an integrated and collaborative ecosystem, and no longer in silos. And the solutions that we offer must now be whole government approach, and not so different ministries have their own way of doing things. It has to be now whole government approach and whole societal approach. And we need to actually work together now to solve the problem for humanity, and no longer about how each discipline can provide the solution. So in short, complex global issues, therefore, will require a collaborative ecosystem to actually connect the dots and provide the solutions that can create a sustainable change. And to do this, we need to move research across the value chain from fundamental to translational research with impact. And the solution that we now offer has got to be discussed in the quadruple helix, and the community, government agencies, and industry, all this must be engaged in the discussion and involved in the implementation. Constant engagement and constant networking needs to be there. So, okay, that's the global outlook. Let's come down now to the national landscape. What's happening in the country, right? We have gone from agriculture-based economy to manufacturing to innovation-led, and now we are moving to humanizing economy age. And when we talk about humanizing, this is now just like we are talking about humanizing education 4.0, which is what KPT had launched for higher education. We're also now talking about humanizing economy as far as economy is concerned, where now it is no longer technology-centric, but rather people-centric, right? So this is something that we all need to be wary about, where wisdom, collaboration, and values now play a very important role. So it is therefore imperative for future-ready Malaysia, as we now educate our talent, where our talent is heading, right? We're going now from very material-based to now knowledge-based, from a production-based economy to now an innovation-driven economy. And before, when we talk about numbers, with KPI, we're talking about output, but now with KIP, key intangible performance or return of values, we now talk about impact, right? So research is also going now from just simply output, how many Q1, how many Q2, how many conference, how many whatever, to now at the end of the day, did you make a difference? Okay, so with the research that you have done. So instead of talking now about survival, we are now talking about resilience, because it's not just about surviving. How can now be attacked again by future challenges, we'll still be able to stand tall. So that is resilience. And the talents that we have by just saying, you know, capability, capacity building. Now we want not just capacity building, but we want the talent to become change makers. And before, if most of the time, we are working in silos. I mean, even in the school of medical faculty, we have many departments, and each department is also working in silo, and within each department pun working in silo juga. So, you know, now we have to now start working in a collaborative ecosystem between the school medicine and the engineering and whatever else. And if we're going for individuals, we are now going to networking. And if you work at own pace, we are now going to immediate response, because we need agile response now. And from reactive to become proactive, from punitive to become preventive, and from whatever we do because we are obligated to now values driven. So the future of Malaysia, as we now see with our Foresight 2050 done by the Academy, we are actually moving towards a harmonious, a prosperous, a progressive, and sustainable Malaysia. Right? So if that is the case, then the key lessons from COVID-19 must be seen from the social and spiritual angle as well, because the pandemic has had an enormous impact on people and societies, not just physical, but material, mentally, spiritually. And therefore, this involve, especially those in medical decisions, everything about medical decision involve people, patients, people, family, people, professionals, the doctors, the nurses, etc. All may have seen many traumatic events, and all of these people, at the end of the day, you and me, we all have values. And when we talk about values, it's often based on our system alone is not enough. Science and technology is not enough. So we need health, social, spiritual, environmental care must be seen as a more integrated ecosystem. So to all the young lecturers and to the students listening, we are now working on an integrated ecosystem. So to combat this will require a whole government approach and whole societal approach. And we also need to take care of the environment, because if the lack of care of the environment and awareness will lead to more zoonotic diseases that will now have more of this being transferred. And therefore, again, what I'm trying to say is that as we move forward, we're going to be faced with more pandemic if we don't take care of this planet. So therefore, we need to collaborate, and we need to collaborate by making sure that humanness is the center, and we need to now work with all the solutions that we offer. It has to be nature-centric and also value-centric in order to create impact. So what it means that the future of research in Malaysia is to be able to do research and innovation in a responsible manner. So this is why we call RRI, Responsible Research and Innovation. And when we are doing that, the solution that we offer need to talk about planetary health as well. Is it sustainable? Especially when we are formulating research designs in the future. So what I want to stress upon, the key message is that STIE, Science, Technology, Innovation, Economy-driven solution for Malaysia's future society has got to be people-centric, nature-based, and values-driven. And what it means now is that this is why I want to set the scene to say the sharing of information and no longer in silo, but more of nation approach and societal approach. All these are imperative for Malaysia's future. So therefore, now we come to the topic of the conversation today. So why is networking important? I think I've set the scene to say that collaboration with local and international colleagues, I think now becomes very important, because as we now provide the solution, and we are supposed to be human-centric solution and not just technology-centric. So diversity is very important. You need, when you talk about human in the center, diversity is important. Inclusivity is important, because all this will bring in different perspectives and dimensions based on differences in culture, in faith, and in values. So therefore, it's not only important, the collaboration is important because it will make a good addition to your CV, but collaborating also has other advantages, especially when you collaborate with different countries, with different diversity and different social background and culture, because it will now, believe me, create for you an enriching. When you start to ask for their feedback, they will give you a fresh perspective on your research topic. And therefore, if you start to discuss your ideas together with this group, it will strengthen the arguments that underpin your thesis, your research, and actually clarify your supporting evidence. So many researchers believe that age index is important to have a successful career. Betul. I'm not saying that that's not true. But what we are saying is that while these are indeed the main ingredient for success, but now, as I say, when we start to move forward in terms of the future of research, and collaboration and networking now is becoming increasingly important. And when you communicate with others, basically you enrich your work in many ways, and you can communicate with people at conferences, through cooperation, through discussions, and via, of course, social media. And this basically, when you start to communicate and have different, you know, not just from UKM, but actually when you start to talk to USM, to talk to UM and UPM and UTM and all the other universities, it will essentially allow you, plus also, don't forget, interacting with the IPTS, because it will allow you to have this exchange of thoughts with your peers, and you learn more about the views and on different subjects. And once you start to undergo collaboration and networking, you will end up having to learn, having to unlearn, and having to relearn new things. And at the end of the day, once you start undergoing learning, unlearning, and relearning, why not you sit down to co-create something fantastic, something viable? So having friendly relationship with other researchers can basically open the doors, manalah tahu, you know, for successful job interviews, research collaborations, and especially accessibility to specific facilities and infrastructure, especially if you're coming from a non-RU, perhaps where your facilities is not there, and you need to now be able to go into some deep tech work, and therefore you need to be attached to the universities that have all this infrastructure. But by doing this kind of networking, it will open up and allow your students to now undergo attachment in that particular lab that you would want to be there. So therefore, the sooner you start building a network, the better. You don't have to say, oh, I'm just a PhD student now, or I'm just doing a master. I don't have to create yet. I think you need to create like today. All right. So and especially if the lecturers were listening in, for professorship application, being well connected and carrying out research in a cooperative partnership with industry, with multinational, really give you the competitive edge. I will have to say this after evaluating many kenaikan pangkat. What we are saying is that if you now say, okay, you got a professor, that's Jusa C. But if you want to move to B and you want to move to A, what is now going to be your value add that you're going to now be able to contribute? This Q1, Q2 papers, okay lah, but enough is enough. You've got already your professor. The next level So this is the kind of things where networking and collaboration now becomes very important as part and parcel to explain how much of an international figure that you are, because that does make a difference to moving up from JUSA C to B or an A. So of course, the next question you're going to ask is why do I need this network, right? Okay, it requires a little bit of reflection on your part, like where do you stand right now in your career, and basically what do you want to achieve, and what support might you need in order to do so. And again, you know, you want to go into a networking, you also must ask the question, what is it that you have to offer in return? I mean, you just can't go in there and actually now not show not pull your weight, right? And when you start to this networking, it's not about old boys network. Yeah, old boys network means you know, old boys network like MCKK boys or you know, MRSM boys or whatever. Of course, girls, TKC girls, that also make a difference. But we're not talking about that. That is like only network that is accessible to select few individuals. When we create network, it's based on voluntary collaboration and principle of reciprocity needs to be there. So once you want to build this kind of network, networks are not created overnight. You got to build that, you know, and it will take time, and you need to be maintained and developed over a longer term. And when you are creating this network, it is the need to develop rapport, bonding. And when you start to do this kind of network, it has to be with sincerity. People can tell, you know, that you just want something out of them. And at the end of the day, there's no they don't trust you. So basically, when there's lack of trust, being sincere about pulling your weight, then you can forget about it also. So if you now want to now start to build up conference dinners, receptions, coffee breaks, you know, usually these are the kind of things you don't want to attend, you know, it's like, but a lot of people who are ambitious probably would want to go for these conference dinners. But let's not wait for anyone who's just ambitious. I think that anyone who's going to build your career now have to start to go to these conference dinners and receptions and actually talk to people during coffee break. And you know, this is the kind of thing that you see. You gather again with your small group of friends during coffee break and you all talk to each other, but the coffee break is meant for you to now go and see other people. That is the whole idea. And perhaps you're not doing that because you're shy or you're the kind that doesn't want to now meet up with people, but this has also got to change. And sometimes you get to meet a lot of people in a more friendly manner and you can create better friendship. Post-conference tours, these are good places for you to approach new colleagues. And what I find, you know, sharing of taxis to go to the airport also create opportunity, because, you know, when you share the taxi, it's mono a mono, you are, you know, that, you know, make sure that you thank others every time when you are in the network. Don't forget to say thank you when you receive some help or information. So being polite, being reliable, being genuine, appreciation of all the people involved in the network, all these are very important factors. As you want to build the network, you know, don't focus only on the highest level of contact. This seems to be like, you know, a bee to to the flower, you know, like, okay, you have these important people, and at the end of the day, you just zoom to try to get to talk to these important people. So please value, don't focus only on the highest level contacts. Horizontal contacts with people of the same as you is just as valuable as the people who are the vertical contacts higher than you. So when you plan your network, consider your own qualification. And sometimes I will say don't aim too high, because if you're like a doctoral candidate, it's going to be very exhausting and futile to independently attempt to enter into or an icon in your field at a conference, because he will be surrounded, or she will be surrounded by so many others who are involved. And therefore you will be like, you know, you're sitting there waiting for your time and standing there waiting for your time, and that's a waste. It's better for you to do the horizontal context with other PhD students and other postdocs and other young lecturers, because, you know, they are young today, but they're going to be somebody in the future. So it will open many doors, especially to lab facilities, and open up your mind on how others are progressing in research and how they're going about it. So to me, as I see it in the academia, in academia sciences at ASM, we have the Young Scientist Network. This is a scientist academic career in STI, who is less than 40 years old, 40. So, and when they get together with the help from the fellows from the academy, you find that they get a lot of exposure very early on as to what it takes to make STI your career. Sometimes, you know, let's be frank, even in your own university, you don't find mentors or sponsors in your university. You don't have, you know, because sometimes your university may not be an RU, and you're not going to find the icons there that, you know, like you saw Idola or whatever. But the thing is, they may be outside of the university. So the gathering of the fellows with the help together, working together with the Young Scientist Network, the YSN, I think is a very enriched experience. And even the YSN together, when I have young academics from other universities, non-RU, when they come together, they now see, open their eyes, open their mind, you know, to what is actually happening in the country, and what's the latest. So that opens the opportunity for them to do a lot more. Yeah. So need to work on your communicative and social skill, because networks, you know, they function on mutual exchange. So your EQ kena tinggi lah sikit, ya, so that you are sensitive to body language. You know, sama orang suka you ke tak suka ke apa yang you bercakap ni. So basically be sensitive, body language, read the body language, and therefore develop communicative skill and learn to recognize subtle differences between the conversations. Make sure that you know whatever you're talking, is it going to be sensitive to others or what, you know. And some people, you know, like for you to flatter, and some people hate it because they know that it's not a good way to start the conversation. But whatever it is, you also need to talk a little bit about yourself, but not too much. But more important, when the big guns are talking, listen, because they are imparting some information that you probably would need, right? And of course, learning by doing, experiential learning, I think is the best. It will be very important, because you can be listening to me, you can be reading some books or whatever, but do it. Doing, as what Nike said, just do it. That is how you'll be able now to create opportunity, to create the contact, and actually be brave about doing this. So attend presentations, conferences, and colloquia. It's like this, you know, I bukan apa dah, I cukup sakit mendengar apa mereka yang kata, oh, that topic, I know everything about that topic. Tak payahlah, I think I need to work on my lab lah better. You know, agahnya, the bahasa Kelantannya agah, maknanya you're very arrogant, that you think that whoever is a speaker can no longer enrich your mind regarding what needs to be there, can no longer enrich your knowledge. Basically, be humble, because knowledge always, you know, when the more you know, the more it should humble you. So that's why, for me, I think when you are young, please, and there you ask the good questions, and present clear, interesting papers, so that people also know what exactly are you thinking, right? And therefore, when you are young, please get involved in the bodies and associations at your department and at university. So in short, I would just want to say some do's and don'ts. Do ask the questions, do talk to the speakers, do show your interest in other people's work, because that is and seize every opportunity to tell others about your work as well. do have your own work ready to present. If they ask, oh, you have something, oh, can you show me? So at least you have that on your computer. Do have an opinion on the matter and do join the debate. This another thing. Hey, hello, I have worked on this so many years, I know everything about this, so don't make claims without evidence. This is something that I even at the academy, where we have our fellows average age 67, you can see that pada hemah saya, based on my experience, there's a lot, but data today may not be as you experienced before. Don't boast and don't overkill, because when you talk with data, and don't say like, I'm right, you're wrong, please be more diplomatic. And what I found was that it's like this, rather than say I'm right and you're wrong. So, and of course, do not patronize. All right. So how to do the how? Okay, so I've already set the scene for you, why we need collaboration, networking, some of the things that you need to know about. The next question is how to do the how. I'm now finding out that if you give suggestions, it doesn't really quite work, because when you want to really do it, somebody need to guide you on how to do the how. Okay. Come back to you all know, I said many times, conferences is the best place for you to make connections and for you to meet other researchers in your field. So when you're doing that, when you're attending the conference, look for the meetings in your area and attend those meetings, and check out who are the keynote speakers and shortlist who you want to meet and the kind of questions you might want to ask. I mean, I was facing this when I went. So you have so many Nobel laureates to choose. So you got to choose a Nobel laureate that is going to talk on topics that is very relevant to you. But when you have the opportunity to talk to the Nobel laureate, you got to be prepared with the kind of question you want to ask, because at the end of the day, you don't want the Nobel laureate to think, oh, hello, what kind of question is that? So basically, you need to be prepared, because other people are also listening to the kind of question that you are going to ask to a Nobel laureate. But basically, at the end of the day, you need courage. Habis cerita lah. You need courage to speak with people you don't know. All right. And but the more you do it, the easier it's going to become. It's going to be right. So always bring your the other thing, when you go and talk to people, bring your name card. There's no such thing. Oh, I lupa lah my name card. As if people remember you. Come on. So bottom line, that's what I say. When you want to attend conference, be prepared. All these checklists kena ada dah. Name card, who you want to meet, what time, which, especially if a conference has got many tracks, which track do you want to go? All this homework needs to be done, and not just a conference because you want to you want to go out and do some shopping. So all these are preparations. So an easy way, conference, of course, to start a chat, to ask people questions about their work. And most academics usually enjoy talking about what they're doing, and if you will feel comfortable on the subject. And this usually works rather than talking about the weather, right? And this shows that you are interested, and which is very good as an opener. But when you go to the conference, right, paper, because a lot of the times you can be very quiet, but the day you present and your ideas are so good, people will just want to come and talk to you, and that's how you create the networking and collaboration. So because it becomes, when you present and people listen to what you have to say, so that idea itself becomes the opening act, to break the ice when having conversation, and becomes a way for the collaborator to actually gain respect for your work. And besides conferences, there are other ways that you can build this solid network. You can also attend courses and events and join organizations on discussion on different subjects. And you may also establish contacts, because you just met this guy and he's working on this, and when you go back, you keep that name card because you want to be able to contact the guy by email or social media. So taking the first step to start a new research collaboration I think it's an excellent way to introduce yourself to other academics and let them know about your work and interests. What I'm trying to say to you is that if, like for me, you know, I usually attend the typhoid conference. So if you consistently attend the conferences that is within your domain or expertise, you will find similar people around. And the more times you attend, for me, like, the more times I attend the typhoid conferences, I was giving talk, other people was giving talk, the more I start to build and strengthen the network with typhoid group, you know, so that this is where you now start to create new friends, start to establish a rapport with old friends, and within this typhoid conference, you know, you share bus transport from the hotel to the conference. I tell you, that is a very good way. So every day I will change partner. Who do I sit with? Because it makes a lot of difference, you know, to have small talks and whatnot, but it builds up into a longer, more lasting relationship, and you give it an opportunity to get to know people better. So that's one. The other one is be open, friendly, and confident, because networking involves meeting people and exchanging ideas with the aim of making a good impression. When you are communicating, it's important to understand their needs, be friendly, be open, and be able to listen to them carefully. You should speak about yourself because your peers also need to know what exactly you're doing, and showing a genuine interest in the other person. Avoiding arrogant behavior can help you a long way. But when you are talking, right, the goal is to make other academics see you also as a colleague, not as a fan. You know, a lot of the times they say, oh, Prof, you know, you are my idola. I mean, this is the kind of language I usually get. But at the end of the day, I don't know much about you, and therefore I can't help you if I don't know much about what you're doing. So it's important that when you go in, that even people, for me, when you are introducing yourself to me, I would not also need to know, at the end of the day, see you as my colleague. Because as I say, even my graduate students, you know, I see them as my colleague, because there's as much as they learn from me, I learn a lot from them as well. So, so to achieve this, so it's important that you show respect without showing reverence. And most people will not connect with, you know, because if you say you are just here to be able to be a passive one, you just want every information from you, and most people will also not connect with someone they consider to be significantly inferior to them. So you must always keep a good portion of self-confidence when communicating, so that people also know and people also respect. We can now work together. So remember that an effective network does not happen overnight. It will take a lot of dedication to create one. And when you want to start something, collaborating, reach out to the authors when you're reading papers. Don't be afraid to reach out to the corresponding author, ask him questions that, you know, so that you can have further discussion. But also another one is to volunteer. ASM, when we are doing all the policy papers, we do a lot of stakeholder engagement. So what we do with the stakeholder engagement of the quadruple helix, we put the YSN group as the one who help to do the report, to do the organizing, because once they are part of the technical committee, you have the opportunity to actually listen to the fellows or the brains in the country together with the stakeholder engagement, and you learn a lot when you are given this opportunity. So that's why sometimes you say, oh, I want to be a member. No, you can become the slave first, the repertoire and whatnot, so that you start to pick up and you start to learn. So because it's through these committees, you may discover opportunities to co-author white papers with the committee members, and actually now widen your professional network and contribute to your publishing record. Because when you start to publish with icons like this in the technical committee, you walaupun nama tu your name can be somewhere in the center, but it starts to build up your publication and your CV. So if you have the opportunity to do so during your PhD or postdoc, or even when you are a young academic, please volunteer yourself to be a member of the technical committee, even if you serve as a rapporteur or someone who write things together, because the one who write things together, all the icons will come to you because they will now be able to share the information and you get a first hand. And this is how I think most of the YSN, they build their career also by getting to know the fellows, because the fellows can open many doors for them. So that is one aspect. The other one is to do an exchange program or attachment so that you get to know a lot more people. And for those, build a lasting bridge of networking communication, send your graduate students to your colleagues network in your lab, etc. Let's say you send your graduate students to Japan or attachment, yeah. So when you start to do that, building lasting bridge of relationship, you know, sometimes you dah balik daripada university and you want to have relationship, continue the collaboration with your graduate students for attachment, etc., with the professor's lab. So that way you are building that relationship. You know why? Because this constant contact, that's why I said building networking is not something you do overnight. It's something that you put labor in, you put time in, and it will reap you your benefits, because the constant contact will make you invaluable for future projects and joint publications. And if they say, oh yeah, European Union, we need someone from Malaysia, automatically your name is on the list, right? And you get millions after that. So this is a great way, because the European partners are the one who's writing the grants and you are the one receiving the grants. So this is a great way to get collaborative grants, especially from European Union, also especially with with the Japanese grants, JICA and so on, StarTraps and so on. So the other one is, of course, to use the online tools. Another way is to create an international network of collaborators, of course, to start to use the social media. I think the young people, they will know how to go about this with Twitter, with LinkedIn and Facebook, especially LinkedIn. And you can use this to communicate with the peer experts, the track research related to your work, and support or follow the impact of your publication. And even if you do not want to post yourself, you can still use the social media tools to actually stay up to date with what are the recent advances in your field and find out what the others are doing. All these digital tools also keep you in track. Like I said, sometimes in the conferences, meeting people is one thing, but staying in touch, this requires discipline and organization and dedication to ensure that network develops. So you have to follow the, sometimes in the network, you have people, the progress of your fellow PhD colleagues, and send them congratulations note when they graduate. If you connect with LinkedIn and actively engage with the content, be sure to also compliment them when they get promotion or they get their job. So when I say require discipline, is because, you know, this is a two-way street. When the people are networking, a lot of the time you ask the question and your colleagues will answer the question for you. You know, simple things like solving some lab issues, some problems with pH, etc., or whatever results that you have. Networks can answer this quite fast because they are, you know, working in the field. But you also, when they ask you, you also need to answer your colleagues. This is a must, right? Answering emails without delay when, because when you have delay, it will show a lack of interest on your part. And you know, invite international colleagues to the thesis committees or your PhD as external examiners. If your student is ready to graduate, invite them, the external collaborators that you have in your network, to now become external examiner to your student, because after all, they are international. And you know, like for me, I'm working on typhoid, so I will get the people international to be now an evaluator, external examiner to the work by the students on the topic, because that their thesis, but it makes the thesis even better, because if that international guy, upon reading the thesis and find that the thesis is excellent, this will be the word of mouth punya puji-pujian that actually can open many doors, and even you know, for postdoc opportunities, etc. So it will strengthen and showcase your own research as well with the international expert. And once you start to build this kind of network, to me, you know, take a sabbatical. And usually sabbatical, you spend time in Malaysia. Tak payah lah, take this sabbatical and go and spend time in your colleague near lab. And because your networking is very good, they may even offer you as postdoc fellow or visiting fellow position in the other university with your friends. So, but this sabbatical, 5 months, 9 months, actually great opportunity to sit down together with your colleagues in the network to actually now develop ideas, share your research finding, create new thinking, etc. Foundation of the collaborative relationship. And so by expanding your research network sorry, beyond your institution and around the world, you will create a rich and living academic career for yourself. And that's how you become now international icon. And it is through your professional contact that you're going to form lasting relationship that will see you through your career and beyond. So in short, what does all this have in terms of people who are working in health sciences and in medical sciences? Why collaboration and networking is very important? Because international collaboration is growing exponentially. And researchers from different institutions and countries work together as a consortium to actually focus around specific research questions. So having this international collaboration are valuable, will offer interdisciplinary expertise and actually allow recruitment of patients in different settings. And I'm telling you, this is really great if you have already created some innovation for drugs or for vaccine, especially me in the area of diagnostic, is a great for clinical trials, for drug trials, and field trials for diagnostics or for vaccines. So establishing this research network and collaboration in a form of non-government, with NGO, with non-profit, voluntary participant, also provide the necessary flexibility to be able to adapt to a wide spectrum of arising challenges, especially for me, if I work on topics with typhoid, developing diagnostics, but for low resource settings, and this is where I would want to have the collaboration with countries that are low resource so that we can now understand better in the kind of technology that we need to develop so that it is not just high tech, but also high touch. So it enables shared learning, you know, or you open your mind to a lot of new things, and perhaps then once you now exposed to this kind of environment, it will make you now even better in terms of being creative in how you provide the solution. And of course, new research opportunities, establish new projects, joint applications for funds and technology transfer is always there. So the collaboration, this is the other one, especially in medicine, when you start to do drug trials, clinical trials, and field trials, you may end up having 50 names on that paper, but the collaboration will definitely increase citation of research manuscript that you are. This is important for us, you know, because the whatever you may say, big names get papers published in Q1, Q2, or mainly Q1. And actually your name are being attached to that help you also in delivering the kind of papers that you are publishing. But it gives you an opportunity to have papers published in all the major journals. Because you're working with an international iconic researcher. So if you have, so bottom line, ladies and gentlemen, if we have a fragmented scientific community, very small research group, low in terms of funding, that is now probably describing our situation together today, collaboration therefore and networking is the way forward. Because I end by saying, by working together today, hopefully we can shape a more positive tomorrow. So with that, thank you very much. Assalamu alaikum.
Thank you very much, Prof. Asma. That's a very, how would say, enlightening, powerful, and I would say rich with all the tips and tricks that I think you have gathered along the way of your research journey from the beginning. And I think this topic is not only for those established researchers, but also for young researchers who are going to, you know, start their journey in the academic world. I think, let me just start the question and answer session. I'm sure there are a lot more people who's going to start their question. Maybe I think Prof. Yin Ping has question for you first. I mean, Prof, you want to start? Yin Ping?
Yes, yes, Prof. Asma.
Yeah.
I actually have question for you. I actually can't agree more with you that we researchers should not be working in silo, and we should start going out to approach others. But the problem is we may find face rejection, just like a grant application. That's
Yeah.
why those established researcher want to collaborate with you. So how we can make ourselves more attractive to others so that they were willing, voluntarily wanted to agree to collaborate with us. Yes, that's my
Yeah.
question.
Like I said, what did I say? Communication skills, very important. Your personality, your character, how you behave when you're seeing someone. You know, it's all about rapport at the end of the day. You know, it's not like everybody wants to collaborate. Tak semua orang lah. You know, you say, oh, can I work with you? Oh, sure. No, not everyone is like that. Some people are very choosy. Some people are very picky. You know, they want to see why you want to be able to collaborate with you. What's your end game? You know, so that kind of stuff will also be running around in some of the icons in your head, right? So tak semua orang is open and want to collaborate. Some people also, even their icon, they prefer to work only with their research team because their research team understand what is needed, how they need to think, you know, by having new people coming in is sort of disturb the balance, and they are on a speed about mereka kena produce results within this kind of milestone, so they're not willing to have a lot of disturbance lah. Okay, boleh macam tu juga. So as I said, you're gonna face a lot of rejection, but you never know. You may hit jackpot. That's why I said, you know, one way I've always say, you know, this bus transport from hotel to the conference is a great way to break the ice, because sometimes they look like they are not approachable, but when you start to sit beside them and you start talking, and you just break the ice, and then you just be yourself, you know, and when you start, there's a lot of laughter and whatnot. After that, that's it. That network is done. So you know, smart way lah, how you want to approach people, you know. Sometimes after the conference, you gotta, like, it's like bee to honey, right? Everybody just semut to gula lah. Everybody will just go, say, oh, it's fantastic, your bagus juga, because people who are talking were, like for me, if I was giving a good talk, you know, and people come to me and say, oh, this is excellent, I also feel good at the end of the day, you know, like you put in the time and people appreciate your work. Okay, that's fine. But for me to collaborate further dengan you, I kena dengar you dulu. That's why I kata that, you know, when I say I kena dengar you dulu, that means in the conference, present the paper. And when you present the paper, that's when I know about your work better. And I know how you think and what make you tick. And that's I say, I want to work with that guy. You know, that's why I said that kalau pergi conference bakal duduk kat belakang, lepas tu makan mie, makan cucuk, whatever you're just gaining weight. Okay, so bottom line is that you know, when you go to conference, you dah tahu, and that's why I pilih the track that I want to go, because I don't have much time. So I pilih the track and I want to hear this guy. And so I will tick, you know, I will go in this time to hear this guy and then go to the next track because I want to hear that guy. And then from there, I tengok what is it that I want and how I want to work. So dia kena homework lah. You know, Prof, you can buat some homework and then see and then go from there. And then you can tell, you know, from the personality, cara dia bercakap, whether dia ni jenis approachable atau forget it. If you try pun dia takkan ni. So macam tu lah. Rejection you're gonna face, but take it, because it's gonna be tak apa, it's okay. You're lost today. Maybe somebody else will be a better one for you. You never know. Okay.
Thanks, Prof, for that very interesting, and I think again you share good tips there. So ingat semua orang jangan makan sahaja. So going to conference is not just about shopping and eating. So it's also about doing, homework
especially going to
before.
international conference.
Yes, yes, yes.
Abang nak pergi shopping and you find that the last day semua orang dah tak attend. The first day semua orang attend, the last day nobody is attending because people
Yes,
are going
betul.
shopping and the person is talking to himself. Yeah.
Prof Wong, any other questions?
I pass back to you.
Okay, thank you. Okay, so I have few questions here in the Q&A. So I'll read the shorter one first. So what are the barriers or challenges that you have experienced, Prof, in establishing your research network and forging new ones? Anything that from your experience that was very challenging, and how do you overcome it?
You tanya sometimes this question, I'm like an outlier though. In my mind kan, I tak pernah lagi face. I tak pernah face barrier lah. That's put that way.
Because maybe I think because you have the correct, how would I say, approach to things, maybe the way that you say just now.
Maybe lah.
Yeah,
Maybe,
it first starts with your introduction and the way you carry yourself and how you carry your research. That actually makes people
dia
interested.
macam ni tau. For me kan, I'm also not the kind who's brave to go and talk to somebody just like that, you know. I say to myself lah, okay, when I go in, let me speak. Because after I speak, then people hear my thinking, you know, especially when you go to a huge typhoid conference and Malaysia, the Malaysian scientists producing diagnostic apa ni, I mean kami lagi hebat, right? So they will have that kind of attitude, right? So I always say, you know, allow me to speak. If I speak, then people will come and start talking. So that has been my principle. I tak approach orang dulu. I speak dulu. Lepas I speak, then people say, yeah, I heard about your paper and this and that. And then that's opening act, you know, for us to further and develop. And what do you have in your lab? And I just continue lah. Nampak tak? So that's why I always say, you know, I tak suka jadi passenger, I tak suka jadi observer. So when I go to a conference, I actually am a speaker, either plenary ke, kalau keynote lagi lah kan, dah tua-tua macam ni orang bagi keynote je. Tapi, but when I'm young, I usually am a speaker. I go in because I want the opportunity to be able to share my thoughts. And then paling kurang pun I will get people yang sama level. That's why I say horizontal context kan. Jangan duk fikir orang atas saja, fikir horizontal. Sebab today they are researcher like you, but tomorrow they are going to be somebody big. And but you build that relationship from today. You know, like when you are in Harvard, right? Harvard Business School. All the PhD from Harvard Business School one day will become multi-billionaires. But you invest in them as you know them in the horizontal, you know, esok lusa dia dah graduate, dia jadi multi-billionaire, you just pick up your phone and say, hello guy, you are there, can we connect, you know, terus business dah jalan, right? That's the whole idea. For me also, in fact, you know, bagi I prefer horizontal because horizontal is investment. Horizontal tu maknanya tengok cermin-cermin diri sendiri lah. Kalau saya masih postgraduate, I prefer to work with the horizontal because I will nampak macam mana dia orang berfikir, macam mana lab dia orang, you know. Then if I need a lab, you know, esok lusa bila saya dah jadi professor sekarang, one phone call from me, I will send my student over, right? So that makes a lot of difference to open up the lab. Sebab kita kenal. Jadi dalam academic science lagi lah pula, siapa yang tak kenal, kalau jadi presiden, memang semua kenal presiden tak kenal. But bottom line is that, you know, you get to hear a lot of people and for me, horizontal dulu. Before I go vertical. Vertical ni buat kan you say, you baru PhD and then you nak jadi besar macam mana? Oh, the icon akan bercakap dengan icon aja. And you notice, when you go to conference, where do they put the icon? In the VVIP table, right? Bila ya you nak bercakap dengan dia orang? For sure.
Lepas talk barulah pergi cari dia orang. Tanpa dia orang dah pergi makan lah.
And all the organizers like Dr. Wong will always, will take care. People like you also will take care of the speaker. Oh yeah, please come have your tea. And then kepala I kata, kalau next time I go to UKM, if we ever have a face-to-face, allow me to sit, Dr. Wong, with the other people for my tea rather than the conference organizer.
Yes, of course. Rather than running here and there, wasting the opportunity to talk to all the distinguished lecturers, we asked the academician to sit down with the distinguished guests to maybe forging new network.
Yeah,
And,
betul. In
yes.
fact, that's what we had at Lindau when with the Nobel laureate. Every major has a Nobel laureate. So you register lah nak duduk dengan Nobel laureate mana. But they give you the opportunity. They never put the Nobel laureate in the VVIP table. Every Nobel laureate, the head is every table, the head is a Nobel laureate. Nampak tak? So it gives you opportunity. So I think Prof Wong, this is somehow kita kena learn lah in our cara kita, sebab Malaysia ni hospitality bagian nak gila, and so memanglah the conference organizer will make sure that you are taken care
well
of,
fed and well seated.
Yes.
But we also need to also invest, Prof. So I really very taken with the saying that you were saying, return of value versus return of investment, because I think if we aim for return of value, the ROI will be taken care by itself. Do you agree with that, Prof? Yeah. So looking back to our question, I think we have exceeded the time, but it's very interesting talk again. But if I may ask you the last question from the audience, in the morning, Prof. Lee Yong Ye shared on tips of writing winning research grants. If you care, Prof, please, if you may have maybe your top 10 tips or 5 top tips on the area.
Writing, winning apa ni?
Winning research grant.
Research grant. I pun tak tahu what Prof Lee. Prof Lee, of course, from USM, right?
Yes,
So,
one of your
also
academic
my
science.
student before, I think whatever he has to say is already sufficient. Sebab nak dapat grant sekarang is different from nak dapat grant dulu. Alright, so that's why I think you need to hear from grant sekarang. So grant sekarang is based on impact. So and kalau macam Malaysia's Grand Challenge, the Strategic Research Fund, if you don't show collaboration with quadruple helix, memang for sure tak dapat lah. So sekarang ni everything is about impact now for moving forward. And sekarang ni is about 10-10 my SDIE. So that's why kalau grant, even FRGS pun dia kena tanya, how is this related to 10-10 my SDIE, right? The one that is voted by academic science. So which is now part and parcel of changing the research landscape of the country. So what I'm trying to say is that the more you know how technologies are put together in creating the kind of impact and working together with collaboration, lah ni semua has to be that way now. And sekarang ni, I mean, sorry lah, you all tak selalunya you tanya kan macam mana nak tulis. No, when UKM, when you call me, it's always about leadership, but you don't ask me about research. So next time call me about research.
Yes, of course. We will, of course, extend our invitation to bring you back again about research. Maybe we'll talk to Prof. Tan after this with Timbalan Dekan to bring you back. So firstly, I would like to thank you, Prof. Asma, for spending your precious time with us. I think we learned a lot during this talk and session. I would like to also extend my thanks to Prof. Tan and also the Dean for our 24th Medical Research Week this time. And it is indeed an honor to have Prof. Asma with us today. I would also like to extend my thanks to all the committee members here who've worked very hard. And we are looking forward to our 25th Medical Research Week next year, which is our Silver Jubilee. And indeed, we expect to again invite you, Prof, so to give us more pearls on research.
Okay.
Thank you very much, everybody. Thank you, Prof, for the attendance today. Thank you very much to all the listeners and all the participants. I hope you gain insightful information and also good lessons for your research life or research journey. Thank you, everybody.
Okay.
Assalamualaikum warahmatullahi wabarakatuh and everybody. Bye.
Bye.